Supervisors are responsible for ensuring workers can safely carry out their work. To do this, supervisors need to know where and how their staff can be hurt and put in place changes to remove or reduce these hazards. The main hazards in healthcare include overexertion from lifting or repositioning residents, falls from slips and trips, violence from aggressive residents, and exposure to infectious disease. Hazards are identified by gathering information from sources, such as worksite inspections and injury statistics, and learned by talking with staff and the Joint Occupational Health and Safety Committee. In this video, you will see how Donna, a supervisor, identifies a potential hazard while doing her regular work.
Hey, how was your weekend?
I haven't had one. I've been in charge of this whole floor for the past 2 day shifts, and today too. It's been crazy.
I could only imagine. Well, what's going on this morning?
Well, a new resident arrived late yesterday afternoon from the hospital, a Mrs. Lowry.
Well, what do we know about her?
Oh, not a lot. The paramedics have her records, but I haven't had a chance to look at them yet.
Do you know how she's doing this morning?
I spoke to Jean at shift change, and she mentioned she was confused, didn't sleep very well, and also was a little edgy. But that's pretty normal.
All right. Well, I'll go and introduce myself and see if she wants to get up for some breakfast.
Okay.
Mrs. Lowry, good morning. May I come in? May I help you?
Just let me do it on my own.
Hey, we're told to transport this lady direct to here from the hospital. This is Doris Lowry.
Yes, we were expecting Mrs. Lowry. Do you have her discharge papers?
Yeah, I do.
Thanks. What do you know about her?
Well, she has dementia, diabetes, and she's hard of hearing. Unfortunately, they had to admit her to the hospital to get her diabetes under control. While in the hospital, the social worker felt that Mrs. Lowry is just no longer safe to stay at home.
Okay. Is there anything else?
Yes, Mrs. Lowry gets anxious, and she has been aggressive when there are changes to her routines or she gets a new caregiver.
That's good to know. I'll go over her records as soon as I get her settled.
Okay.
Mrs. Lowry, welcome to Beechwood Manor. We're very happy to have you here. My name's Donna.
Where am I?
You're at Beechwood Manor. I'm here to help take care of you. How are you feeling?
I'm just tired.
It's okay. We've got a room all set up for you. Let's take Mrs. Lowry to her room. We have her set up in room 313. This way. Mrs. Lowry's our newest resident. She was admitted late yesterday afternoon. Her records indicate that she has a history of aggression, especially when there's been a change in her routine or care providers. I've put a purple dot on her file. I need everyone to document her behavior on the behavioral observation record for the next several days so we can identify any triggers for aggression and plan for her care accordingly. Remember to check her file regularly for the latest updates.
Mrs. Lowry, we got to set up your diet plan for while you're here.
I don't want to go on a diet.
Oh, no.
I've ordered an assessment by the clinical care team. This will take place over the next few days.
And you're just going to...
Once the team completes Mrs. Lowry's assessment, then we'll have a better idea about what her needs are. Remember to add any new information to Mrs. Lowry's file and report any changes in her condition or behavior.
She likes toast for breakfast, right?
I'm also meeting with Mrs. Lowry's daughters later today, after which I'm hoping we'll have a better understanding of Mrs. Lowry and her likes and dislikes. Until we know more about Mrs. Lowry and can develop a care plan, I want everyone to be careful and be aware of how Mrs. Lowry is responding to staff and the other residents.
You just saw Donna, the supervisor, identify a potential hazard, the aggressive behavior of Mrs. Lowry, and assess the risk of workers being injured because of this behavior. Her assessment began as part of a routine admittance procedure, where she used existing information to determine that a hazard did exist. Donna then gathered information from various sources to assess the risk. Based on the information gathered, she put in place measures that would minimize the risk of staff exposure to violence. She also alerted the staff, as the key to any safety measure is to ensure that information is communicated to all who are at risk. When identifying and assessing the hazard, ask yourself, what are the hazards? How at risk are my staff, and have I consulted with them and others? What are my options to minimize these hazards? And what do I have to do immediately, and what can I put in place over time?